Being a pediatric oncologist, I get asked quite often, is chemotherapy safe for my child? Even after the diagnosis of cancer, the parents, of course, are very curious and anxious to make sure that we are not giving any toxic, substances or toxic medications for their children. I also get asked what are the most common side effects. So, chemotherapy, is it safe for children? First of all, we need to remember that we are dealing with a life-threatening diagnosis, which is cancer. So, cancers in children can be quite aggressive, especially if it is blood cancers like leukemia, lymphoma, brain tumors. They can be quite aggressive. And if not treated, if not diagnosed at the right time and treated the right way with the right medications and drugs, then we are talking about, losing the child probably to this cancer diagnosis. So although we know the side effects of chemotherapy, we would still advocate giving it to a child who has been diagnosed with cancer so that we can save the child's life. Now, coming to side effects of chemotherapy, most of them come with side effects of hair loss, nausea, vomiting, some effects on the kidney, some effects on the heart, but these are all, we are talking about 10% or 15% seen in 10 to 15% of the children who receive. So if there are 100 children who receive chemotherapy, there may be 5 to 10 children who actually face these side effects. And being pediatric oncologists, we are specially trained so that we evaluate the child for their organ functions. We dose the chemotherapy according to their body weight or body surface area, whichever is applicable depending on the age of the child, and also according to their organ functions. We ensure or we take the utmost care that we do not give chemotherapy doses beyond what is required. Especially for children, there is a limit to the chemotherapy they can tolerate. More so, there is a limit to the chemotherapy they need depending on their diagnosis. So giving excess is not going to be of benefit, it might be of harm to them. So as pediatric oncologists, I'm trained to make sure that the child receives the amount of chemotherapy that is absolutely required. Most of these side effects can also be controlled with the various number of medications we have available, like nausea and vomiting. All of these used to be a huge concern in the past, but now we have enough medications to make sure that all of these symptoms can be controlled and the child can still be happy, normally active, taking normal food and going about their activities. So more of these concerns should be addressed in detail with your pediatric oncologist because pediatric cancers are curable. Yes, even though we use chemotherapy, if used the right way, in the right judicious manner that they're supposed to be used, they can be of utmost help in curing these cancers.